Okay, hi, my name is Jenny. I'm going to be your nurse practitioner today. So we're going to be doing a physical exam on you. Can you please tell me your name and your date of birth?
Rilla 2/18/94.
Okay, do you know where you are?
At the doctor's office.
Okay, perfect. I'm going to repeat 3 words and then just repeat them back to me, and then at a later point I'm going to ask for them again. So table, chair, towel.
Table, chair, towel.
Okay, perfect. And now we're just going to go ahead and do a quick eye exam. Can you read these letters to me?
Yeah. T, X, T.
Okay, perfect. So your vision is 20/20 and your cranial number 2 is intact. And can you repeat those words back to me?
Table, chair, towel.
Okay, perfect. And also, can you tell me today's date?
Today is April 30th, 2023.
Okay, perfect. So your speech is clear and intact, and you're ANO times 3. Okay, so now we're going to go ahead to your head. I'm going to be inspecting your hair, and then I'm also going to be touching your head, okay? And let me know if you feel any pain or anything, okay? Okay. Any pain?
No.
No? Okay. So you have equal full hair distribution. I don't feel any bumps or tenderness, or I don't see any dandruff or scaliness. Your head is normocephalic. Okay. Now I'm just going to look at your eyes and your face. Your face is symmetrical. Your eyebrows and eyelashes have equal hair distribution. I'm going to look into your eyes. Okay. Okay. Your sclera is white. Your conjunctiva is pink. Your iris is brown. Your lacrimal ducts, I don't see any excessive tearing. I don't see your eyelids drooping over your eyes. Okay. I'm going to move on to your temporal pulse. Okay. Any pain?
No.
Okay. So they're +2. What do you call it? I'm going to feel for your sinuses. Okay. Any pain?
No.
No? Okay, perfect. Now I'm just going to take a look into your eyes. Okay, so just look at me. Okay, your pupil is equal and reactive. And then I'm going to take a look into your eye. So we're going to be checking for macular degeneration. I'm going to check for the cone of light and your red reflex, and make sure there's no arteries that may have ruptured. Okay, so I'm gonna go in. Okay. Okay, perfect. I don't see any ruptured vessels. I found your red reflex. Everything looks good. Let's see. Now we're gonna I'm gonna check for confrontation and accommodation. So just follow my finger. Okay, perfect. And then also, you're gonna just follow my finger again. Okay, so I'm gonna start here. Okay, so that's checking your cranial nerve number 3, 4, and 6. Okay, so that's good. We're also gonna be checking your sense of smell. So that's gonna be checking your cranial nerve number 1.
Alcohol?
Okay, sorry. Okay. I'm gonna be looking at your nose. I'm gonna touch your nose. Do you have any pain?
No.
No? Okay. So I'm just gonna look into your nose. Okay.
Wait, and put the cabinet.
Okay. Alright, your nose is pink membrane, pink mucosa. I don't see any septal deviation. I don't see any lacerations. Everything looks intact, pink and intact. Okay, can you smile for me, please? Okay, perfect. Now, can you stick out your tongue? Okay, can you go from side to side? Okay, sorry. Okay, I'm gonna be checking your gag reflex. Okay. I'm sorry.
Right.
I'm so sorry. Okay, so that's checking cranial nerve number 9 and 10, and also cranial 12 when you stuck your tongue out. Okay. Okay, and so your buccal mucosa was nice, pink, and intact. Your tonsils were +1. I didn't see any swelling or irritation. Okay, so I'm gonna go ahead and I'm gonna check just your muscle strength of your neck. So if you could just turn. Okay, perfect. Now this one. Okay, perfect. I'm gonna check your C-spine. Okay. Okay. Any pain or tenderness?
No.
No masses. Okay, perfect. Let's just do a quick range of motion. Can you put your head back, forward, to the side, then turn side to side? Okay, wonderful. Everything looks good. Your range of motion is good. Also, I'm gonna do just another test on your cheek. Okay. Just close your eyes. Okay. What do you feel?
Something soft.
Okay, perfect. So that's checking cranial nerve number 5. Okay. And now we're gonna do your ears. Okay. I'm gonna do a test to check how your hearing is. Okay. So just close this ear. Okay.
1, 2, 3.
Okay, perfect. And then I'm gonna be now checking the Weber test. So I'm gonna strike the tuning fork and put it to the middle, and then let me know if you hear equal.
Yes.
Okay, perfect. Now I'm gonna do the Rin test, and that's gonna be checking for AC over DC, like air conduction. Okay, so I'm gonna strike it again. Okay, do you tell me when you stop hearing the vibration?
Now.
Okay. I'm sorry.
So yeah. Now.
Okay. Okay, perfect. Okay. What else? I'm gonna be checking also your ears. Okay. Okay, and before I touch your ear, I'm just gonna palpate. Any pain?
No.
Any pain?
No.
Okay, your ear is nice and symmetrical. I'm just gonna take a look in. Okay, your ear canal is pink. Your tympanic membrane is intact. Okay, it's pearly gray. Okay, and also, I forgot to mention that your cranial nerve 7 is also intact. Okay, and then we're gonna move on. I'm gonna be palpating your lymph nodes. Okay. Okay. So occipital.
Mm-hmm.
Okay. Then preauricular, postauricular. Any pain or tenderness?
Mm-mm.
No. Okay. Then tonsillar.
Mm-hmm.
Okay. Then submandibular. Okay. Then mantle. Any pain?
Mm-mm.
No. Okay. So then I'm going to be checking for the posterior cervical chain.
Mm-hmm.
And then if you just turn your head a little bit more, I'm going to be checking the deep cervical chain. Any pain?
Mm-mm.
And then also I'm going to be checking your clavicular lymph nodes. Any pain here? No? Okay, wonderful. Okay. And also your superficial. Any pain?
Mm-mm.
Okay, great. Now I'm going to be checking your chest. I'm gonna palpate first. Let me know if you feel any pain. Any pain here?
Mm-mm.
No? Okay, I'm gonna go to your back and I'm gonna check your back. Okay, any pain?
No.
Okay, great. Okay. Now, I'm gonna do, I have to percuss and I also just need to inspect real quick, okay? So, I would just check. I don't see, your skin is intact. I don't see any masses. Your skin is nice and clear. Okay. All right, so I'm just gonna percuss your back, okay?
Mm-hmm.
Okay, and I'm gonna be checking for tactile fremitus.
Mhm.
Okay, so just say 99.
99, 99, 99.
Okay, perfect. And now I'm just gonna take a listen to your back. Okay, so just take a deep breath in and out. Okay, perfect. Your lungs are clear in all fields. I don't hear any adventitious breath sounds. I'm going to be checking for your AP, I'm going to be checking for your lung expansion. Okay, so take a deep breath in. Okay, perfect. It's 1 to 2. Okay, and I'm also going to be checking for your diaphragm. Okay, so I'm just going to percuss. Okay, now just take a deep breath in. Okay, and then take a deep breath out. Okay, I'm going to mark this here. Okay, perfect. Okay, so for a normal person, it should be between 3 to 5 centimeters. Yours is approximately 4 centimeters, okay? Okay, and then also I'm going to need you to, I'm going to take a listen again, and you're going to just say the word E for me, okay?
E, 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 E.
Okay, and now you're just going to whisper 1, 2, 3. Okay, perfect. So we're just checking to make sure you don't have pneumonia. Everything sounds nice and clear. I'm just going to also take a listen to the front, okay? So just take a deep breath in and out. Okay, perfect. Now we're going to go ahead and we're going to listen to your heart, okay? First I'm just going to inspect and we're going to palpate, okay? So let me see. So again, any pain or tenderness? No. Okay. So I'm going to be checking your aortic pulmonic, aortic pulmonic, tricuspid, and mitral. Okay. So I'm going to take a listen, okay? And due to privacy, I'm just going to listen over your shirt, okay? Okay. Okay, I'm going to turn it over and listen this way. Okay, just lean over. Okay, perfect. Now can you lean back for me, please? Okay, perfect. I heard S1 and S2. I didn't hear any murmurs. Heart sounds were good. And now I have to if you could just sit up for me one more time. I'm sorry. I have to just check your trach for any deviation. Okay. So if you could just swallow for me. Okay, perfect. And I'm just gonna feel for your thyroid. Okay. Okay, perfect. You didn't feel any pain or anything?
No.
Okay. And also now I'm gonna just need you to lay back down for me. I'm gonna have to check your carotid and JVD. I don't see any JVD distension, so that's good. I'm gonna just take a listen to your carotid, make sure that I don't hear any bruits. Okay, perfect. I didn't hear any bruits. Your pulse is palpable, which is good. Okay. And I'm just gonna I'm just gonna check your other pulses since I'm here.
Mhm.
Okay, so I'm just gonna
Sorry.
look this up. Okay, it's okay. All right. Okay, perfect. I'm gonna check your groin. Okay. Your inguinal. Now I'm gonna check your popliteal. Okay, I'm gonna check your and then your dorsalis medius and your tibial. Okay. Okay. Oh, and then I'm just gonna check to make sure that your radial pulse and your apical pulse are matching, that there's no differentiation between them. Okay.
Mhm.
So I'm gonna just take a listen here. Okay, perfect. So they're reading at the same time, so that's good. And also I'm gonna have to check for your other arteries to make sure that there's no bruits. Okay. Okay, perfect. So I'm checking the aortic, I'm checking the iliac, and I'm checking the renal and femoral. Okay. Okay, so there's no bruits heard on auscultation. Now we're gonna just go ahead and move on to the abdomen. I would inspect the abdomen, check the skin, make sure there's no lesions or bruising or anything of that nature. And then after inspection, I'm going to percuss. Okay. So I'm gonna percuss abdominal sounds. Any pain?
No.
Okay, and I'm gonna be checking for all the sounds are tympanic when I percussed. I also need to check for your spleen and your liver.
Okay.
Okay. Okay. But before I do that, I'm just gonna take a quick listen. I'm gonna start at the right lower side, making sure to listen for bowel sounds. Bowel sounds are present in all four quadrants. And then I'm just gonna percuss again, I'm sorry, and I'm gonna check for your liver and your spleen. Okay. Okay. So your abdomen is tympanic. I'm just gonna check. Okay. Your liver ends about here, which is normal. And then I'm just gonna make sure that I don't feel your spleen here while I'm percussing. You don't want to feel your spleen because that would mean splenomegalia, which isn't a good sign. Next, I'm gonna go ahead and palpate. Let me know if you feel any pain. Any pain?
No.
Okay. So now I'm just gonna deep palpate. Any pain?
No.
No? Okay. And then I'm just gonna kind of hook into to just check for your liver. Okay, are you okay?
Mm-hmm.
Any pain? Okay, good. Okay, perfect. We're also gonna have to do I have to check your renal. Okay. So you're gonna feel a big you're gonna feel a strike on your back, okay? Any pain?
No.
No. Okay, great. Okay. Now we're gonna move on to range of motion. Okay. So let's do abduction, adduction. Then we're gonna do extension, flexion. No, flexion, extension.
Got it.
External rotation and internal rotation.
Mm-hmm.
Okay. Okay. now we're gonna do range of motion of your elbows. Okay, so just that. Okay, then open your hands, perfect. Then do this, perfect. Then if you could just take your fingers and do this, okay, wonderful. Okay, so you have good range of motion of your upper extremities. I'm just gonna palpate. Okay, any pain or tenderness? I don't feel any for any crepitus. I'm gonna palpate your hips as well. Okay, any crepitus, any pain? Okay, okay, perfect. So your range of motion of your upper extremities is good. I'm just gonna we're gonna do some exams to see how your strength is. Okay, so push. Okay, perfect. Now pull my hands. Okay, perfect. So you have 5 out of 5 strength in your upper extremities. What else? Also, I'm gonna need you to do a shoulder shrug. Okay, so just shrug your shoulders. Okay, perfect. So that's just checking your cranial nerve lumbar 11. And now we're gonna go on down to your hips. I want you to just take one knee and bring it up to your chest. Okay, perfect. Now take the other knee and bring it up to your chest. Okay, perfect. Now if you could just kick with this foot. Okay, wonderful. Okay. And then also, I'm gonna need you to, so just move your foot like this. Okay, perfect. Okay, and I'm also gonna have to check your TMJ. So just open and close. Okay, perfect. Any pain or tenderness? No. Okay, wonderful. And also, I'm gonna be checking your fingers. Okay, I'm gonna check your cap refill. Okay, it's less than 3 seconds. And I would also be checking it on your toes as well. Okay. I don't see any edema on your legs. Your skin is nice, warm, it's intact. I'm gonna have you do another test. If you could just close your eyes and put your hands out. Okay, perfect. Just for a few seconds. I don't see any deviation of your hands, so that's perfect. Okay, you could go ahead and put them down. Now I need you to, so you're gonna take your leg and you're just gonna touch from your knee all the way down. Okay, wonderful. Okay, so that's good. Also, let's see. Okay, so I have a few other tests that we're gonna do, but we'll do the standing one later. We're gonna do a sensory test now. Okay, so just close your eyes and let me know what you feel. Okay. Okay.
Sure.
Okay.
Sure.
Okay. Perfect. Okay.
Soft.
Okay.
Soft.
Okay. Perfect. Now I'm gonna also do another test. Okay. Tell me what you feel.
Vibration.
Okay. Perfect.
Vibration.
Perfect. Okay. Now we're also gonna test your reflexes. Okay. So first I'm gonna be checking your brachial reflex. Okay. So yeah, just right here. Okay. Perfect. Now I'm gonna be checking your radial reflex.
This is a hard one.
It's not going.
Yeah. There. Roll doesn't have reflex.
Okay. Now I'm gonna be checking your knee reflex. Okay, perfect. Okay. Okay. Oh, and then one more here. Okay. Your elbow. Oh, there you go.
Worst reflexes.
Okay. Okay, and now I'm just gonna have you do a test. If you could just stand up. Okay. If you could just walk straight. Okay, perfect. And now if you could walk heel to toe. Okay, wonderful. Now if you could walk on your tippy toes and on your heels. Okay, wonderful. Now if you could bend forward for me. Okay, backward. Okay, then side to side. Okay, I'm gonna palpate your spine. Okay. Any pain, any tenderness? Okay, okay. Now also, can you touch my finger and then touch my nose? Touch my finger and touch your nose. Okay, perfect. Okay, you can go ahead and have a seat. Your spine is aligned. You have a good gait. Also, if you could just close your eyes, and I'm gonna put an object in your hand. Okay.
Fun.
Yes. Okay. And then I'm gonna take your foot, and I'm just gonna check your Babinski reflex. Okay. Great. Okay. Okay. And then for the last exam, I'm gonna need you to stand up one more time. Okay. Just close your eyes. Okay. Put your hands out. Okay. Okay. I want to make sure that your coordination is good and you're balanced. Okay. So perfect. Okay. So that concludes our exam. Do you have any questions? Okay.
Yeah.